and enteric viruses, protozoas, and helminths. The main causes of food poisoning. Cross-contamination. When microorganisms are transferred from one surface to another. Another one is time, temperature, and abuse. When food is exposed to high temperature for more than 4 hours, it can contain the toxins. Poor personal hygiene. Food handlers act as the carriers. In the category of bacteria, there are main infections are botulism, infection by E. coli, Salmonella, Shigella, Staphylococcus. Under the virus comes Norwalk virus, rotavirus, and hepatitis A. Early symptoms of food poisoning. First thing we get is the chills. You feel feverish or shivering like that. And the heartburn. And the upper part of the stomach, you feel like burning. That is called heartburn. And you feel like vomiting, that is nausea. This is the other symptom. Then you will get some dizziness. When you stand, you are going to fall like that feeling. And the other, heat, that is the temperature in the body. The body temperature rises due to infection. Symptoms are dysentery, renal failure. And sources of food: undercooked ground beef, unpasteurized apple juice, undercooled fruits and vegetables, raw milk, and dairy products. Firm up the stool and reduce the symptoms of diarrhea. Next, please. Flaxseed oil, it relieves both constipation and diarrhea. And ginger, prevent the spread of bacteria that may lead to diarrhea in the first place. Next slide. Mineral water. Mild and severe diarrhea can result in the loss of dangerously large amounts of fluids. Peppermint oil, it can reduce bowel inflammation and soothe the digestive tract, reducing loose stools. Next slide, please. Should I see a doctor for food poisoning? Yes, see a doctor if you have the following symptoms that are very severe, including bloody diarrhea, diarrhea that lasts more than 3 days, high fever, temperature over 102 degree Fahrenheit, vomiting so often that you cannot keep the liquids down. Signs of dehydration, which include not urinating much, dry mouth and throat, and feeling dizzy when you stand up. That means you have low blood pressure, like that. So in this case, we have to see the doctor. 5 signs of severe food poisoning: the same: bloody diarrhea, vomiting so often that you cannot keep the liquids down, fever more than 102, dehydration, and signs of diarrhea more than 3 days. Next slide, please. How to prevent food poisoning? Wash your hands with soap and water before, during, and after preparing food and before eating. Use soap and hot water to wash knives, utensils, cutting boards, and countertops. Rinse well the vegetables and the fruits before using, and refrigerate properly. Avoid unpasteurized milk and juice. Separate raw meat from eggs, seafood, and poultry from other foods in the fridge. Next slide, please. Tips to prevent food poisoning. Wash hands and surfaces Keep raw food separate from other food. Cook food to its proper internal temperature. Put leftovers in the refrigerator within 2 hours. Keep the refrigerator at 40 degrees Fahrenheit or below. Always, prevention is better than cure. Please. Thank you.
End of the slide, doctor. Dear participants, kindly note as this is the session ended. If you have any doubts to clear, you can either post in the chat box or you can directly ask to the doctor. It's time for interactions. There is one question. Doctor, can I read that? Shall I read for you? One question is from Srihari V. Menon. If food are kept a long time in the fridge, will it be contaminated? That is a question from Srihari.
Time for in the fridge. Any food kept in the fridge to be taken out and cooked and heat properly so that it can kill the bacteria or germs. But long time is 2 or 3 days is okay.
Okay, doctor. Any other questions? Questions?
Madam, myself Rajesh. I'm a teacher from Bhavan Seva. Can I ask you? It has been told that the food prepared, uh, that is boiled the food, prepared food, and all has to be eaten within 3 hours. That is what generally a talk is there like that. After that, it starts tailing slowly. So, what is your view of? Can you give me some view about that? Because I used to explain to children, but there is a dispute that the children make the food has been made in the morning, and by the time they eat, it will be 4 to 5 hours. So, is this what I tell is correct or not? That the food which is prepared has to be consumed before 3 hours. That is my question, ma'am. Over to you.
Okay, food prepared in the morning. Usually we give morning prepared food for children to the schools. We are also taking the food to the offices and all. So if it is well prepared, it won't spoil that early. And whatever leftover food we have to keep in the fridge within 2 hours.
Okay, madam. Okay.
Thank you,
I
doctor.
think better to consume it completely as what we do in olden days, isn't it? Not to keep it inside the refrigerator for a next day and all.
Yeah, that is always better.
Okay, thank you, ma'am.
There is one more question, doctor. Kirtana Praveen. What is the easiest way to prevent cross contamination? That is the question.
The food prepared to be kept in the proper containers, and before putting in the container, wash the container properly. Also, your hands should be washed properly. Then the cross contamination can be reduced. And in the fridge also, keeping the food separate, like vegetables in one section and poultry or meat in the another section. This all can prevent, and properly covered boxes that will help cross contamination to prevent cross contamination.
Thank you, doctor, and thank you, Kirtana. Any more questions? There is one more question from Darshan Jayakrishnan. What are the medicines used for food poisoning?
As I told you, food poisoning occurs with bacteria, virus, or fungi. So parasites also are involved. So for bacteria, we have many types of antibiotics according to the culture we can use the antibiotics. And for parasites, we have metronidazole, dysentery causing amoebias. And virus, there is no antiviral medication available, but we have to replace the fluids and control temperature and all. That is a symptomatic management. Okay.
Thank you, doctor, and thank you, Darshan. There is one more question from Anthony Prince. Uh, it is said that you should cook the vegetable before you eat. That means you should eat all the vegetable cooked or raw. I hope the question is not clear, I think. Is it clear, doctor?
Yeah, but some vegetables we can eat without cooking also, no? Like cucumber, the things used for salads and all. So, like carrot, you can wash well first the vegetables and peel the skin. Then use proper cleansed cutting board and knife. Then you can use it immediately after preparing that salad, like raw vegetables. So, not necessary all vegetables should be cooked properly.
Thank you, doctor, and thank you, Anthony. Hope the questions are over. If any other questions are there, we can move to the concluding session. Is it over?
Doctor,
Yeah.
doctor, yeah, I am Anirudh Menon. I have a question. Can we eat the part of a fruit which is like bad and like the cut it and eat it? Like a portion of a fruit is bad and we can cut it and eat the rest of the fruit.
It is not advisable. Sometimes it may be bitten by some insects or birds or something like that, or there is some infection cause the fruit damage. So better to avoid that type of food.
Okay, thank you, ma'am.
Doctor, there is one more question. The question is from Veena. It is regarding the junk food. What you can suggest to give suggestion to the parents regarding the eating of junk food? That is a question from Veena.
Okay, junk foods. Please look for the expiry date on the package. If it is usually if the date is gone, then better not to use. And this shawarma and all, if the same day prepared, it is okay. If it is kept for a long time, it may be contaminated with bacteria that can cause infection or poisoning. Is it okay?
Any questions? Hope the questions are over. Regarding junk food, I have a question, doctor, because not only the time is not the matter, as it is a junk food, there is most of the cases like puffs, parota, in that all cases, and like packaged food like uh, Lays. In all that cases, and ultra processed food items also, there is no any protein content or any healthy aspect is there. So, is it good for kids? What's your opinion?
See, if every day if you are consuming the same thing, it's a problem. If you once in a while, if you eat, it will not make much. That's my opinion.
One more question, doctor. Is it okay to have it 2 to 3 times in a week? Because we are taking some data related to this, which, as far as possible, we are uh, telling parents and students to avoid the frequent consumption of junk food. So, in most of the schools, we got certain data regarding the consumption habit. So, in that, we got many of the students are having junk food more than 3 or 5 times in a week. Is it good or what is your opinion in that matter?
Always fresh cooked food is preferable. Like our old generation had idli, dosha, idiyappam, all are steamed food, all are very good for health. But the junk foods still only easy method. That's all. No, not good for daily.
What is the most serious type of food poisoning? That is from Kashish Prabhakaran.
Cholera was the dreaded infection in the past days. Nowadays, like typhoid or other infections, as I have told, it's not, cannot say most serious one.
Okay, thank you, doctor. Now I would like to welcome Anthony for a formal vote of thanks. Over to Joanne.
Ma'am, can you hear me?
Yeah, you are audible. Yes, you are audible.
Just 1 second because my camera is turning on. Namaste and a warm good evening to one and all present here. On behalf of Organization for Food Safety Solutions and Awareness, an NGO organization, I extend a heartfelt gratitude to all for your active participation in the national webinar on the impact of food poisoning on children. Your enthusiasm and management have truly made this event a great success. First, I would like to express our sincere appreciation to our chief guest, Sri P. Rajkumar, Assistant Commissioner of Police, Ernakulam Subdivision, for sharing us a thought-provoking message on food safety and food security. Your expertise and dedication to the crucial issue has truly inspired us. Thank you, sir. I extend my sincere appreciation to our esteemed speaker, Dr. Limya Charamal Lewis from Burma Hospital, for sharing her valuable insights and expertise there in their topic. Your presentation have provided us with a deeper understanding of challenges and preventive measures on food poisoning on children. A special thanks to the National Webinar Coordinator, Dr. Soumya, for her exceptional leadership and tireless efforts for organizing this event. Thank you, ma'am. Next, I would like to take this opportunity to extend our deepest gratitude to our Principal Madam, Mrs. Parvati E., for advocating food safety measures and to promote sustainable practices. I would also like to extend sincere gratitude to our little star grandmaster, Tirtha Vivek, child moderator and ambassador of OFSSA. Your presence and introductory remark has undoubtedly left a lasting impression on our collective efforts towards achieving food security and ensuring the health and welfare of our community. Thank you, Tirtha. A special word of thanks to all the national webinar coordinators for their nucleus planning, coordination, and seamless execution of this webinar. Thank you all. Last but not the least, we are deeply appreciated for all who have actively participated with insightful questions, lively discussions, and valuable feedbacks shared by all. Your presence has added immune value to the overall experience, fostering an atmosphere of collaboration and knowledge sharing. Thank you all. As we conclude this webinar, let us carry forward the knowledge gained and continue the efforts towards safeguarding the health and well being of our child. Thank you.
Thank you, Joanne, for your energetic attitude. It was very mind blowing one. Thank you so much. It was very